Hi, this is Carmen Enoh. I'm a student pharmacist. Today I'm going to be talking about some important concerning point about the drug aspirin. Aspirin is a salicylate and a non-steroidal anti-inflammatory. This medication has several brands name on the US market. However, one of the most common we see is called Bayer. I'm going to be going over all formulations, tablets, capsules, and suppository. Why are you taking this medication? This medication can be used for several conditions. It can be used to treat rheumatic fever, to ease pain and fever, to treat some type of arthritis, to protect bypass graft and stent in the heart, to lower the chances of heart attack, stroke, and death in some people. How should you use this medication? For all oral products, take this medication with or without food. However, make sure you take this medication with food if it causes you to have an upset stomach. It is also better to take this medication with a full glass of water. For the enteric coated and buffered tablets, swallow whole, do not chew, break, or crush the tablets. For the extended release capsule, swallow whole, do not chew, open, or crush. Take this medication at the same time every day. For the chewable tablets, this drug may be chewed or swallowed whole. For the suppository, it is important to use the suppository only rectally. If the suppository is soft, you can chill it in the refrigerator or run cold water over it. To use it, take it off the foil wrapper and wet the suppository with cold water. Use your finger to push the suppository well up into the rectum. What if you miss a dose? Well, if you miss a dose, take the missed dose as soon as you remember it. But if it's close for the time for your next dose, just keep the missed dose and go back to your normal schedule. Do not take two doses at the same time or any extra doses. What side effect can occur? For the oral product, some side effects that can be seen are stomach pain or heartburn. You can also have an upset stomach or start throwing up. Like mentioned earlier, if you have an upset stomach when taking the medication, you can ease that upset stomach with food while taking this medication. For the suppository, you may have some rectal irritation. Now, what should you tell your health provider before taking this medication? You want to make sure you inform your healthcare provider about any allergies you might have to this drug or any other drugs, any health problems that you may have, such as asthma, bleeding problems, nose polyps, or nose irritation. It is also important to help to inform your healthcare provider about any kidney or liver disease. Also, make sure you mention to your healthcare provider if you are currently taking any other anti-inflammatory medication. It is very important to avoid giving aspirin to a child because in children they may have a side effect called Reyes syndrome. Also, inform your healthcare provider if you have any pregnancy right now or plan to be pregnant in the following time because this medication can also harm the unborn baby. To start this medication, you may store all oral product at room temperature in a dry place. So the bathroom are a place to avoid. It has to be protected from the heat. For the suppository, you can store the suppositories in a refrigerator. Make sure you do not freeze the suppository. Also, Do not use the suppository if they have a vinegar-like smell. And for all products, keep all drugs in a safe place and keep it out of the reach of children and pets. And that is all for aspirin. If you have any question about the medication or side effects you might experiment, you can always call your healthcare provider and your pharmacist. Thank you.